Side effects of the various definitive treatment modalities for prostate cancer, whether it's radical prostatectomy, external beam radiation therapy, or brachytherapy. So, with surgery, surgery and radiation both carry the risk of erectile dysfunction and incontinence. That's been extremely well studied, and the risk of erectile dysfunction in published trials for both surgery and radiation could be in the order of 50 to 80%. With incontinence, generally with radical prostatectomy, you get some level of incontinence afterwards. The reported literature, the risk of severe incontinence after a year is roughly about 2 to 3%. Obviously, in surgically treated patients, they're more likely to have stress incontinence, whereas in people that undergo radiation therapy, they're more likely to have urge incontinence, and the rate of urge incontinence post-radiation, varies quite considerably, and it's more common in the first 2 years. So specific differences, obviously the radical prostatectomy is a surgical procedure, so it carries the surgical risk, bleeding, infection, damage surrounding tissues, need for additional procedures, there's a catheter, etc. And so there's a subset of surgical risk, whereas with radiation, the way radiation works is it damages the DNA, and that it causes lifelong changes in the actual tissues. So the problem with radiation is that while there is a goal to focus the target radiation to the prostate, it can also be targeted and affect the rectum or the bladder or the urethra. And radiation injury to those structures can cause bleeding, overactivity early on, or 5 or 15, 20 years from now. It can be a lifelong risk of that occurring. Brachytherapy has, initially, when brachytherapy was used, it was developed up in Seattle. It was used a lot for low to intermediate risk prostate cancer. And the data I just presented to you, the reason why brachytherapy kind of went out of favor is that now we're not treating low risk prostate cancer, we're watching it. So there's not an indication many times for brachytherapy treatment for low risk prostate cancer. It can be used with, in some cases with intermediate risk. I think, nowadays where brachytherapy is playing a much larger role is in combination therapy, where you can do external beam plus brachytherapy for patients with very high risk prostate cancer.